increase in the quality of their life, maybe the quantity but not the quality of their life. So these decisions are made by both the physicians and the patients. But in Miami, they're spending 3 to 4 times as much on that end-of-life care. So what's the value of that care, all that money that's going to the patients in the last 6 months of life? 30% of the total costs in health care are spent on the last 6 months of life. So if we're spending that much money on the last 6 months of life, how much are we spending on the first 20 years of life for the children? So again, my focus is on paying for value. We need more data on what is the most cost-effective treatment. We know now what the most expensive treatment is, but that's not always the best treatment. If someone in Miami got hospitalized for unnecessary surgery and had an unnecessary complication, those doctors would get paid a lot more than they get paid here in Iowa. I heard the Mayo Clinic CEO say a few years ago, only in America do we pay the lowest quality physicians 3 times as much as we pay the highest quality physicians. And we all think of Mayo Clinic as very expensive, but actually Mayo Clinic has been shown to be very cost effective. So this is what we're looking for. Higher quality care at a more affordable price. Iowa is, like Mike said, second in the Commonwealth Fund rating. No other state has a higher combination of quality and cost effectiveness than Iowa. So that's what we're hoping with this value, is to promote the right treatment, not just more treatment. Give people the correct advice and the correct medication, not the most expensive medicine or the most expensive treatment. So that seems pretty simple. It's a lot more complex than just saying paying for value. But again, this bill, this law has a start to paying for value, and so I think we will see some benefit from that. I'll let the others talk about the Medicare reform.
I had a question from Stacy that this would be a question, so I've written down a few things. It's pretty complicated, so I'm just going to kind of read it if that's okay, just my thoughts on how it will affect Medicare. This bill will affect Medicare. For those starting this year, 2010, there's going to be a $250 rebate to people who are on the Part D, get into their coverage gap, that donut hole. So that is already going to be affecting people and helping people this year. That rebate will, by the time 2020 occurs, be up to 75% of the donut hole. And so you think about the cost of that when you talk about prescriptions. The donut hole basically requires seniors to pay out of their own pocket through that donut hole $6,154. So $250 of that is not a whole lot, but eventually it'll be up to 75%. The other requirement is that preventative care will be included for seniors. I'm not sure if that is something this year. I haven't seen the date on it for sure, but that applies to everyone, whether you're on a group, an individual, or a senior, that your preventative care will be included in the cost of your insurance. There will be cuts to Medicare Advantage, which is the private insurance Medicare supplement. I don't know if anyone's familiar with those. Humana is probably one of the biggest carriers of that. And that cut is going to be $132 billion over 10 years. Well, guess what? One of the things that the Medicare Advantage plans include is wellness. And so the Medicare Advantage plan, if they're going to be cut, that $132 billion over 10 years, they're probably going to get rid of the wellness, but then they're required to have it, so I'm not sure how that's all going to shake out. They also, the bill or the law is supposed to reduce the waste and fraud in Medicare at a savings. But if it's there to be had. Why hasn't it been done before? Supposedly the savings from the fraud and waste is going to extend Medicare benefits and make it solvent for another 10 years. We'll see. The hospitals, as far as Medicare payments, supposedly are going to be reduced by $22 billion, and that is over phased in from now until 2019. There's also going to be a reduction in home health care under Medicare. And again, that is $440 billion from now until 2019. So you're talking cuts to benefits, or somehow. And add to that, that if the consumer price index for Medicare benefits rises in the next 5 years beyond the consumer price index, then there's a 15-member advisory board who, after this 5-year period, will be talking to Congress and the President about how do they get this back in whack as far as costs without raising taxes, without changing benefits, and without rationing care. I don't know how they're going to do it.
The fee-for-service model, as Dr. Kitchell talks about, rewards multiple procedures. So that's how I get paid. One thing that strikes me is my last career was 12 years in Florida, and there was a tremendous amount of fraud and abuse. Home health companies, DMV companies, just some shady providers. I think Medicare has to get out of the business of letting everybody in and really being selective and saying, we need the best, we'll pay for the best. But when you let everybody in, it's the folks that are in trouble. What am I going to do? Well, I'm going to cheat. And that's just, it's worse for everybody else. Jolene mentioned the Medicare Advantage being reduced. Well, Medicare Advantage was being paid 20 to 21% higher than Medicare fee-for-service. And by the way, the hospitals were getting the same payment. So there was a sort of a built-in extra cost over years that Medicare was paying, government was paying for. They did have a wellness benefit, but the 20% gap in payment, I don't think correlated to the wellness benefit that was provided. The law also, there are many profits made by pharmaceutical companies and medical device companies. And they also have a share of, just like hospitals having to see reduced payments, they're also paying for part of this healthcare reform. And lastly, I just wish we could make healthcare a little bit more simpler. It's extremely complex. The billing, the coding, the payment, cost reporting, it's just incredibly complex, the administration of the program. And if there just was a simpler approach, I think there would be a ton of savings realized by everyone.
My question may have been answered already, but I reviewed the health bill. I don't know what the law actually came out to be, but I didn't see anything significant about preventative services or preventative care and the encouragement of preventative care. We always talk about how much it costs to go to the hospital. How much does it cost to avoid the hospital and the doctor?
The final bill actually does have some increased payment to promote preventive care. One of the problems that people don't realize is that not all preventive care is cost effective. For example, there was a society that recommended treatment by men, drug to prevent prostate cancer. And if we would offer that drug to every man in the country, that would cost us about $1,100 per male per year for everyone in this country, just to reduce the incidence of prostate cancer. So